Right now in the United States, there are more than 6 million Americans who are living with Alzheimer's. Black people are twice as likely to develop it and other dementias. 10 Tampa Bay's Tweelon Wynn explains how a group of researchers is trying to close that gap and how you can be a part of the process.
Individuals in Black communities tend to not be diagnosed as much as white individuals, which means that leaves little room for opportunity to treat and care until the individuals are in a more advanced state.
Dr. Doris Molina Henry is a researcher at the Alzheimer's Therapeutic Institute at USC and playing an important role in something called the AHEAD study, which is testing methods to prevent Alzheimer's. She says it's critical to include Black people and other people of color in the study.
Less than 5% of participants in clinical trials are Black. What that means is that we don't really understand how medications might work in different populations with variations of risk factors.
The study is working with the University of South Florida right now and looking for people between 55 and 80 who have not yet been diagnosed with Alzheimer's or another dementia to apply. Creating more diverse clinical trials can help every person and every family affected by the disease.
And this is the way we change things. This is the way we change. We change risk and we change our health and we change the future course of the disease for us.
So let's take a deeper dive into data from the Alzheimer's Association, which says despite higher rates of the disease, Black people are 37% less likely to actually be diagnosed. Now, because diagnosis often is at a late stage of the disease, Black people are more likely to be hospitalized and spend more money on health care services, spending 35% more than their white counterparts. To learn more about the symptoms and diagnosis, visit 10tampabay.com.